And now I have the pleasure of introducing someone to the stage who was in the same fraternity with Josh, Jonathan Bush. So Matthew and Jonathan, come on out, and the frat boys can get together.
All right, so we're going to have some fun now. Gentlemen, go on in.
Yeah.
All right, so probably don't need to tell this audience, but I will tell you. So Jonathan, you founded Athena Health as a OBGYN clinic in 1998?
A chain of midwife birth centers.
Something
Yes.
like that. Something to do with babies.
It's, you know, I'm getting just starting to love things that aren't true being happily accepted about me. For example, I was not in a fraternity because Alpha Delta was kicked out of Alpha Delta because we had women. And so the Alpha Delta kicked out the Wesleyan chapter, and we called ourselves a sorority and had no fellow chapters. But that's...
we can get past
But
that.
I'm not angry, and it's
good.
all fine. We'll just go with whatever anyone says about me.
Good that you've forgotten and that you're not bitter. I like it. Fantastic. Well, I raised that because then you had a segue into the whole practice management EMR business that some people may remember called Athena Health.
Yes.
You've been on vacation a little bit from that for the last 18 months
Yes.
or so.
Yes.
Maybe in somewhat enforced vacation.
Yes.
And I think you're back.
Well, I'm putting my toe, foot, ankle,
dipping it back
getting in there.
All right, so for those
I
who
don't know where everybody went, by the way. Did you sell this thing? It's suddenly... Anyway.
All right, so you put your toe...
Nothing worse than selling out and coming back to your old girl, you know, and wow. Anyway.
She still loves you, don't worry. Whether she loves me...
I ran into some
whether
Athenistas last
whether
night.
she loves me is another matter, right?
Yeah.
Okay, but let's get back to the dipping your toe back in the water.
Yeah.
The Firefly that's landing on the stool, I think is what you said backstage now.
Yeah, that was
We're
the
doing our
previous speaker. But
we're doing our poop joke as well, all right? So tell us a bit about what Firefly is.
Well, people said, I got lots of wonderful advice after getting fired about, be sure you work out, read a book a day. I'm like, I'm going to drink and hang out with my kids. Leave me alone, But one thing someone said is, hey, you've been attached to something that developed its own needs as it grew into its own creature. And you had to accept when those needs weren't what you wanted to be needed. So think about if you had to do it over again, what would you clean out? If you had Marie Kondo come to your original vision and kind of scrape all the things that accumulated over the years, what would it look like? And I was like, geez, I think it would all be out. Instead of working so hard on making claims a little bit cleaner, like, what are these claims? Why do we have claims? Instead of all these office visits that were clearly designed to get revenue, but really it was just about a quick conversation. Like, why do we have the office visits? God knows we don't need hospitals, or certainly not 80% of them. And so how could I start a fresh approach at what we had in mind that just didn't include all the things that didn't seem necessary, and took that money and, in addition to hopefully profit, put it into the things that seemed to be just absent, despite years and years of everyone speechifying about it. And that's really what the guys at Firefly had done. I actually met the CEO of Firefly when he was an academic. I was on the board at Harvard Medical School, who does their primary care training in the basement of an inpatient facility, which is, of course, a great way to do population health. And they probably wanted me to make a donation, said spend a day and give advice to our new co-head of the Center for Primary Care. We spent the day with this charismatic guy. And at the end of the day, I said, I honestly, do you really feel like you're doing anything, ever going to do anything useful in primary care here? And he's like, no. But is there any chance you could make a donation? And
did he make the donation?
I forgot about him. I left the board after Flyer left as dean, and come to, a couple years later, my wife says, I'm going to work for this company. He's great. He's doing everything you say to do about primary care. And it's the guy. It's Andy Elner. He's actually had the, ovaries to bail out of a very wonderful position at a Harvard facility and start a lonely startup life. And it's beautiful. It's everything you get when you pay $5,000 a month for concierge medicine, but you don't pay $5,000 a month. Your insurance carrier or your employer pays $50 a month. And that's because it's all virtual. So it's the infrastructure and radical accessibility, supreme convenience of a teledoc. But when you connect, it's not for a jug. It's to someone who actually knows who you are, that is proactively helping you with behavioral health issues, weight, anxiety, depression, things that actually you can't get easily, can't even get an appointment for. And by doing those two things well is becoming the kind of navigator that you would actually be in touch with and get navigation from, as opposed to whatever HR department extensions various companies try to sell today. And those three things, to me, are what we need lots of. Real convenience, proactive, behavioral, online, constant relationship, real fellowship with a provider that knows you, and the ability to navigate the unbelievable cost and waste bumpers in the pinball game. And so Firefly's amazing that way.
All right, so we've already seen one round, at least of a well-funded round. You've got the One Medicals, you've got the Ioras,
Yeah.
you've got Oak Street Health,
Right.
Village MD, and Privia. Haven't these guys already fixed primary care?
Yeah, it's all done. Well, first of all, if all 8 of the professionally capitalized and professionally managed companies all went to $2 billion in revenue each, we would be at about 1 in every 30 Americans getting the right kind of care. So there's room for all of us.
Room for improvement, room for growth.
Our perspective is that there's a chunk of people who actually don't want to schlep to an office for the privilege, no matter how nice the waiting room is, whether it's got really good orchids, and no matter whether the freaking forms are on an iPad or not, and no matter whether the wax paper that goes over the table is like silk, just so you can freaking talk about not sleeping. Some people just want to connect. So 50% of our Firefly members talk to us every month. I don't think One Medical, I would love One Medical, except that I don't want to go downtown, block my afternoon.
My doctor follows me on Twitter, so he tracks me that way.
Okay, and that's a form of care. I've developed the ability to not say every single thing that comes to my mind. And I just want you to know that I did it right there. My shrink is following me on Twitter. You see, Dr. Herman? I can do it. Point is, I'm interested in, I like fiduciary services. I like the idea of someone who looks out for me. And what I don't like about the over-bundling, the bundling of the bundles that we are experiencing in all of society. It's not just medicine where, theoretically there's this health plan that's managing care, and they don't know you from Adam. Somebody in, where is United? Like Wisconsin or something? And there's no it's just become too bundled. Or an IDN, knows who you are as you bonk around these various buildings that have been assembled through mergers, which are really focused on raising price. That's not actually a fiduciary relationship. We loved that Google gave us the free apps, and it was like a fair trade at a while. I'll, give you all my time and my privacy, and you'll give me some apps I used to pay for, right? Or YouTube. And now we're starting to say, maybe I'll actually pay for the apps and I'll have a little more control. Maybe I'll actually now unbundle and not share everything with you. Maybe I'll pay YouTube and not watch the ads. We're trying to take advantage of the progress that we appreciate and now take more control back. And I think medicine could really use some of that unbundling, and that means there'll be lots of different ways of going about getting care. But the idea of the silly office that was just there to justify the procedure code, which was just there because you can only get paid through procedure codes, which is just there because we overbundled the notion of insurance. What was that wonderful article? It said, imagine if car insurance included gas tank fill-ups. You fill out your claim to the auto insurance company. I really needed the 999% octane because my car is suffering from, some senile emphysema, and then you'll wait 3 weeks and come back. There'll be a payment, partial payment for the tank of gas. So I think unbundling, is where I was.
So we've unbundled. Let's unbundle you a bit, right? So, we had
more.
Well,
yeah.
We had to talk about Firefly because you foolishly became executive chairman after your wife went to work there. So as she just told me backstage, she has to babysit you at work as well as at home.
Yeah.
But
now that I follow her all day long, I'm starting to find some things wrong with her too, and I'm like, what about that? You made a mistake.
All right.
It's going well. The third marriage, I feel like.
Does your marriage guidance counselor? Is your marriage guidance counselor following you both on Twitter?
No, we don't need counseling. It's amazing.
All right. So let's talk about a couple of the other things that you're doing. So you've got, you're also on a couple of other boards in mental health and analytics.
The theory of unbundling this Borg into things that are done well is everything I'm doing. So at Athena, we were trying to re-platform. We spent too much on it. We became juicy for an activist. Another way of going about it would be a pure tech platform company that actually extrapolates the data layer out, maybe even the compute layer out, and then lets the application companies plug in. There are a bunch of these. One of them is Innovacer. So these guys have basically figured out really, really, really good protocols for getting in and out of Epic and in and out of Cerner and in and out of Athena across lots and lots of instances, in and out of paid claim systems. And they're not going to market selling an alternative. They're not selling another EMR or another billing system. They're just selling a layer of storage and a layer of compute and APIs so that other people can build and change and innovate as developers, but also so that healthcare providers can enjoy some innovation even though they're on Epic or whatever it's called, System Athena. They're all the same, except Athena's a little better.
For a while.
Yeah, we'll see what happens after the buyout. It's like the high school reunion. You go back and it's like, boy, I remember that guy. He just looks like he's put on about $5 billion in debt. But otherwise, it's the same guy. You can see the eyes are the same guy.
All right. Talk a little bit about mental health, given that...
That I almost lost my mind. Yeah.
Well, your mental health...
Same idea with Sondermind. I'm also on the board of Sondermind. So I'm going to put a little money into a few things that I think are what should be next and just ride along and help and see. So Sondermind is basically a network focused exclusively on regular old mid-level mental health. So not, you need to be admitted to be, you are just need to be separated from the notion that you're Napoleon, but just the regular problems of, frankly, weak gut biome, high stress, global warming, over real-time news about suffering around the world life. We're adjusting to the world becoming brought to our eyes. We're adjusting to food where all the little bugs have been killed before we eat it. We're adjusting, and we all need a little bit of help, and it's hard to get. It's hard to get efficiently, and frankly, the folks that are decent at therapy aren't dying to jump into the paid claims third-party world. They can get plenty of business just, with the little noise-making machine outside of the shingle of their, mid-century modern, and you go there and, pay cash or PayPal or whatever, and Sondermind is trying to draw them into the benefit structure that most people have, because while the affluent, have been getting lots of help for lots of things with cash for years, the rest of us can't pay twice, once for coverage and also for therapy, especially if now the law requires that what we pay for coverage includes therapy.
Yep.
So they're kind of pushing out the ability of a really efficient in-person and virtual network that grabs in all these therapist types into the third-party world without them having to think about it at all.
So
it's what I would, if I could have done Athena again and said, look, I'm not going to help you with your dumb contracts that you made when your nephew was home for spring break and he helped you negotiate with Aetna, right? I'm just going to set up a set of contracts, and if you want to be paid instantly and if you want to get out of the crap, you're just going to sign on to my contract. And those will be paid perfectly, and you'll be able to accrue your revenue, and you won't have to think about insurance ever again. We just didn't have the courage or the scale to do that. These guys started right away that way. He said, if you want to deal with insurance world, you're just going to sign on to our contracts, and everyone's going to be our members, and we're going to carry the malpractice, and we're going to do all of the crap. And as soon as you're done seeing a patient, boom, Uber driver, there's money in your bank account. You don't have to think about it. I think that's the way all of medicine should work. This is an area that's in emergence, mental health, and so you can start with a lot of green field. And I'm excited to see other people do it that way. I think it's the right way to go.
All right. You've been watching this for a long time.
Yes.
You wrote a book a couple of years ago talking about the change. And I yesterday showed a talk here which I had an image of a medieval castle with the sort of peasants or the armies trying to storm over the ramparts.
Yes. They hadn't read Machiavelli. They're storming the castle. You don't storm the castle.
You don't storm the castle?
Well, not according to Machiavelli.
How do you get in the castle?
Keep going and I'll get there.
We'll get around to that. How you get into the castle. Okay. Maybe it's the wrong
metaphor. It's good. I'm now providing the attention span in our relationship. Better take another year off.
So, we have the castles, we have the systems. It was just mentioned by, I think, Vivek or one of the folks on the panel here about how Sutter around here is now owns everything, doubling prices, is under investigation. A lot of issues going on there. You're trying to get around, you're funding people and involved trying to get around that. You've been talking about getting around it, whether it's from, I think it was a folks in your book who were up in New York State running a primary care Medicaid clinic, all the way through to, people running urgent care. How are we doing in this transition? We did just have 3 IPOs. We'll have one of the CEOs of that coming up next, Glenn will be on. How close are we to getting the stuff that is the digital health 2.0 new cloud-based stuff that you and I have been talking about for a long time now, anywhere close to that mainstream?
Well, I mean, there's evidence that stuff's happening. It's glacial, obviously. Glenn's IPO is a great example. So that's a company, you don't storm the castle, right? Machiavelli said you just help out the farmers in the fields, and maybe when they're bringing the grain in, they'll bring one of your printing presses to the unfavored priest who's in the low-end, temple, and little by little, everyone in the city-state starts to not listen to the duchy and the duke quite as much. And so you don't bring down the castle, you just bring the attendees down. Oh, sorry. And so, so eventually no one goes to hymns, but they still hold it. And similarly, no one goes to the hospital, but it's still there, and they have the annual chicken dinner, and, everyone gives money to it for some reason. And I like, what Livongo is doing is saying, just go outside the castle walls and get them to give their grain to a different idea. Don't send your grain to the duke. Send your grain to us, and we'll keep people from going into the castle. And I think that's the right way of looking at it. That's what, Firefly is trying to do. Obviously, lots of research shows that if people get mental health, they hit behavioral determinants of health, or 75% of spend. So instead of trying to knock down the castle, which has got lots of lobbyists and has lots of employees, what's the largest employer in every town? It's the hospital. I just saw the New York Times this year, like 2 weeks ago, wrote an article that said, according to our investigative research, the hospital is the most expensive thing in medicine.
Who knew?
I was like, wow, the gray lady strikes again.
It's no longer failing.
Yeah. Right? So that idea is taking hold. And, a lot of work we worked on as a side in Athena, things like the Healthcare Cures Act, which is, it's now illegal to block CCD data. It's junk when you get it, but at least you can get it. And we've got technologies to sort of sort through and find the gems in the junk. And so there are technologies, there are laws, and there's behaviors, and there are evidences of success. I think Teladoc is a success. I think, jumping for your antibiotic or your Viagra or your refill, there's lots of companies on that. And while, our sort of super ego leading thoughtful people would say, that's not real medicine, it's delivered better than real medicine, and that's a start, And so I love those companies. Hopefully Firefly will, add a chunk to that. We'll add something to the back of the convenience, which is the ability to do behavioral support and actually do navigation when people get sick. But I think all of those companies are evidence that we're getting it. There was, people thought for a minute that Obama was going to have Ed McMahon bring a cardboard check and employers were going to be off the hook. And then when the dust settled, the employer's like, oh, no, I'm still completely on the hook. So that allowed these companies and the capital structures and the work around them to keep going again. They sort of paused and they kept going. And now you're seeing IPOs, which are the result of a decade of work popping out. And you're seeing more venture capital go into those things. And I think that, the way all businesses work is there's sort of 10 years of ignominy and loneliness and mostly ending in death. And then some of the people who spend those 10 years end in some money, some real money. And then they spend 10 years sort of growing really fast to inconsequential numbers because we're a big society and a big market. And then all of a sudden there's like 5 minutes, after the first 10 years of suffering and loneliness and the second 10 years of digging and growing like crazy, that suddenly there are a meaningful percentage of the overall zeitgeist, and then they matter. But you have to be you have to go through these life cycles to get there. And then after that, they get regulated and they're irrelevant again. And and I think we've seen a bunch of companies well through the first 10 years, and we're starting to see some sort of towards the tail end of the second 10 years, and they're tracking. And so those are Athena, made it through both 10 years, and now it's, in the hands of people who do these things.
Should be regulated.
Well, I believe in shareholder value. But I see companies like Glenn's and Teladoc, to some degree Athena, as evidence that the process can work and that the people that get through it will actually make a difference.
All right. Well, that's the end of our time, John. It's been John, it's fantastic having you back at Elf Duno.
It's great to be here. Thanks. Maybe we can get together in a circle next time.
All right.
Take care, man.
Thank you.
Thanks, guys.